This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: what is achondroplasia? Answer: achondroplasia is a type of autosomal dominant disease. Question: what is autosomal dominant polycystic kidney disease? Answer: autosomal dominant polycystic kidney disease is a type of autosomal dominant disease. Question: what is familial adenomatous polyposis? Answer: familial adenomatous polyposis is a type of autosomal dominant disease. Question: what is familial hypercholesterolemia? Answer: familial hypercholesterolemia is a type of autosomal dominant disease. Question: what is hereditary hemorrhagic telangiectasia? Answer: hereditary hemorrhagic telangiectasia, also known as Osler-Weber-Rendu syndrome, is a type of autosomal dominant disease. Question: what is hereditary spherocytosis? Answer: hereditary spherocytosis is a type of autosomal dominant disease. Question: what is Huntington disease? Answer: Huntington disease is a type of autosomal dominant disease. Question: Answer: Li-Fraumeni syndrome is a type of autosomal dominant disease. Question: Answer: Question: what is multiple endocrine neoplasias? Answer: multiple endocrine neoplasias is a type of autosomal dominant disease. Question: what is myotonic muscular dystrophy? Answer: myotonic muscular dystrophy is a type of autosomal dominant disease. Question: what is neurofibromatosis type 1? Answer: neurofibromatosis type 1, also known as von Recklinghausen disease, is a type of autosomal dominant disease. Question: what is neurofibromatosis type 2? Answer: neurofibromatosis type 2 is a type of autosomal dominant disease. Question: what is tuberous sclerosis? Answer: tuberous sclerosis is a type of autosomal dominant disease. Question: what is von Hippel-Lindau disease? Answer: von Hippel-Lindau disease is a type of autosomal dominant disease. Question: can you give an example of an autosomal dominant disease? Answer: an example of an autosomal dominant disease is achondroplasia. Question: how do autosomal dominant diseases affect a person's health? Answer: autosomal dominant diseases can cause a wide range of health problems and symptoms depending on the specific condition. Some examples include abnormal bone growth, kidney cysts, colon cancer, high cholesterol, abnormal blood vessel formation, abnormal red blood cells, movement disorders, and tumors. Question: is there a cure for autosomal dominant diseases? Answer: the treatment and management options for autosomal dominant diseases vary depending on the specific condition. Some autosomal dominant diseases, such as Huntington disease and myotonic muscular dystrophy, have no cure and can only be managed with symptom relief. Other autosomal dominant diseases, such as familial adenomatous polyposis and hereditary spherocytosis, can be treated with surgery or medication. Question: are autosomal dominant diseases inherited? Answer: yes, autosomal dominant diseases are inherited, meaning that an affected person has a 50% chance of passing the disease-causing gene to each of their children. Question: are all autosomal dominant diseases caused by mutations in the same gene? Answer: no, each autosomal dominant disease is caused by mutations in different genes. For example, achondroplasia is caused by a mutation in the FGFR3 gene, while Huntington disease is caused by a mutation in the HTT gene. Question: can an autosomal dominant disease be diagnosed with a genetic test? Answer: yes, many autosomal dominant diseases can be diagnosed with a genetic test. This test can detect the specific gene mutation that causes the disease and confirm a diagnosis. Question: are all autosomal dominant diseases inherited from a parent? Answer: no, not all autosomal dominant diseases are inherited from a parent. Some may occur as a result of a new mutation in the affected person, meaning that the disease does not run in the family. Question: can a person inherit an autosomal dominant disease from just one parent? Answer: yes, a person can inherit an autosomal dominant disease from just one parent who carries the disease-causing gene mutation. Question: can a person with an autosomal dominant disease pass the disease to their children? Answer: yes, a person with an autosomal dominant disease can pass the disease-causing gene mutation to their children, increasing the risk that their children will also develop the disease. Question: are there any known environmental factors that can cause autosomal dominant diseases? Answer: for most autosomal dominant diseases, the cause is a genetic mutation passed down from a parent. However, there may be rare cases where environmental factors such as radiation radiation or chemicals exposure may cause mutations in the genetic material that leads to an autosomal dominant disease. Question: are autosomal dominant diseases more common in certain populations? Answer: some autosomal dominant diseases may have a higher prevalence in certain populations due to genetic factors or cultural practices. For example, the incidence of neurofibromatosis type 1 is higher in people of Ashkenazi Jewish descent, while Marfan syndrome is more common in people of African descent. Question: is there any way to prevent getting an autosomal dominant disease? Answer: there is no sure way to prevent getting an autosomal dominant disease, as it is caused by genetic mutations. Some may take precautionary measures such as genetic counseling and testing before having children to know if they carry the gene for the disease, but it's not always possible to prevent it.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the First Aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.